I'm Sue Dyson, and in this session we're going to consider posture, conformation, and muscle development. I call this reading the horse, and I think it's important to perform this in order to predict how the horse might be working, and also to consider what may need to be adjusted in the horse's rehabilitation program. Posture, or abnormal posture, is usually an adaptation to pain. Conformation, however, may be a predisposing factor for injury and/or pain. Muscle development is a reflection of how the horse has worked historically, and that's going to depend on a number of factors, including rider skill, rider position and balance, the age of the horse and its level of training, and what the work discipline is, the fit of the tack, both for the horse and for the rider, and the presence or absence of musculoskeletal pain. We also have to be considering the symmetry of muscle development. In the horse on the right, we can see that the left hind quarter and crus are less well muscled than the right, indicating that it is likely that this horse has been showing a left hind limb lameness. So when considering posture, we have to think about what is normal. And if we look at this horse, we can see that if we take a line from the front of the antebrachium, it's going to hit the ground just in front of the horse's toe. The horse's muscle development looks proportional, being similar in the neck, the thoracolumbosacral region, and the pelvis. This was a clinically normal horse. In comparison, this horse shows a number of abnormalities of posture. The forelimbs are camped under the trunk, so that the line from the proximal aspect of the antebrachium, perpendicular to the ground, finishes up way in front of the toe of the hoof capsule. The tubera sacrali are higher than the withers, and we have to consider whether or not this is inherent conformation of the horse or it's an acquired conformation. And to some extent, this can be determined by stimulating the horse to perform a thoracic lift. That is, by stroking the ventral abdomen of the aspect of the thorax, encouraging the horse inherently to lift the thorax and observing to what extent the back is lifted and the posture of the pelvic region changes. In this horse, we have a number of abnormalities. The forelimbs are camped underneath the trunk, as we saw previously, and this often results in abnormal prominence of the pectoral muscles. The pelvis is tilted, and the hind limbs are camped under the trunk, so that a line which is tangential to the tubera ischii and is perpendicular to the ground finishes up on the ground way behind the hind limbs and is not parallel to the plantar aspect of the metatarsal region. This horse also shows similar postural abnormalities, but to a lesser extent. The forelimbs are slightly camped under the trunk, the hind limbs are camped under the trunk, and the tubera sacrali are higher than the withers. This horse could be stimulated to perform a thoracic lift with improved pelvic alignment,